Welcome to The Explainer. So today, we're going to dig into a really mysterious genetic disorder. It's one that's not only driving the plot of a hit TV show, but it might even solve one of history's biggest medical riddles. The condition? It's called CADASIL. So you might have actually run into CADASIL pretty recently in pop culture. I'm talking about the Netflix series The Fall of the House of Usher. In that show, it's this devastating inherited illness that just haunts the family and, really fuels their whole tragic downfall. But here's the thing. This disorder isn't just some made-up plot device. Not at all. In the real world, researchers are now looking back and speculating that this exact condition might have been the real reason behind the famous mental breakdown of the philosopher Friedrich Nietzsche. So what is this condition? The one that pops up in our stories and might have been hiding in plain sight this whole time, all throughout history. All right, let's dive in and really unravel the medical mystery behind that name. Okay, so the very first clue is actually hidden in its incredibly long name. See, CADASIL, it's an acronym, and once you break it down, it reveals pretty much everything you need to know about what this thing does to the human body. So let's just walk right through it. The C stands for cerebral, which just means it affects the brain. AD is for autosomal dominant, which is, kind of a fancy way of saying it's hereditary. You only need to get that faulty gene from one parent to have the disorder. The next A is for arteriopathy, a disease of the arteries. SI stands for subcortical infarcts, which are basically these little strokes deep inside the brain. And then finally, you've got L for leukoencephalopathy, which means it damages the brain's white matter. Phew. Okay, so we've decoded the name, but what does this condition actually look like in a person? How does it show up? Well, the symptoms can be all over the place, especially in the beginning. For a lot of people, the very first sign is a migraine with an aura. Those weird visual disturbances you can get right before a headache? But then, usually sometime between 40 and 50, much more serious stuff starts happening. We're talking about TIAs or mini-strokes and even full-blown strokes. Mood disorders can also pop up as an early sign. And over time, all these recurring vascular events lead to the slow, progressive cognitive decline, which eventually turns into a really specific, debilitating kind of dementia. And that brings us to the absolute most common and defining feature of this illness. A staggering 85% of people with symptoms will experience strokes or those transient ischemic attacks. It is without a doubt the hallmark of how this disorder progresses. Now, here's where it gets really puzzling for doctors. These strokes, they often happen without any of the usual culprits. Patients might not have high blood pressure or high cholesterol or even be a smoker. And that right there is a huge clue that something completely different is going on at the genetic level. So if it's not those typical risk factors we all hear about, then what is the culprit behind CADASIL? Well, the answer lies in just a single tiny error in our genetic code. This entire disorder, the whole shebang, is caused by a mutation in just one gene, the NOTCH3 gene. So what does this gene normally do? Well, its job is to create a protein that's absolutely essential for the health of smooth muscle cells. And you can think of these cells as kind of like the elastic in the walls of your blood vessels. The NOTCH3 gene basically provides the instructions to keep that elastic healthy and strong. And you can really see the contrast here. In a healthy blood vessel, those smooth muscle cells are doing their job, keeping the arteries strong and flexible. But in someone with CADASIL, that faulty NOTCH3 gene is producing a defective protein. This bad protein starts to clump together on the muscle cells, and that causes the vessel walls to thicken and get all damaged. And over time, as you can imagine, this restricts blood flow, especially to the tiny arteries in the brain. And that is what leads to the strokes and the white matter damage we've been talking about. Right. So how do doctors even figure out someone has this complex condition? And maybe more importantly, what can be done for patients who are living with it right now? Well, the whole diagnostic journey usually kicks off when a middle-aged adult shows up with a stroke that just seems to come out of nowhere. A key step is an MRI scan, which can reveal that really characteristic damage to the brain's white matter. But the definitive, gold standard diagnosis, that comes from genetic testing. They have to actually sequence the NOTCH3 gene to find that specific telltale mutation. And this leads us to a really crucial and honestly a difficult point. As of today, there is no cure for CADASIL. There's no treatment that can halt or reverse its progression. So, what this means is that all current medical care is really focused on just managing the symptoms and trying to reduce the risk of any future complications. So, what does that management strategy actually look like? Well, to help prevent strokes, doctors might prescribe something like an antiplatelet agent, like aspirin. And keeping blood pressure under strict control is absolutely vital. What's really interesting, though, is what to avoid. Because these blood vessels are so fragile, certain anticoagulants can actually be pretty risky. And sadly, when they've tried drugs for other conditions like donepezil for Alzheimer's, the trials just haven't shown any benefit. Okay, so let's circle all the way back to where we started. This surprising mark that a single faulty gene might have left on our culture and even on our history. It's pretty cool, actually. Medical historians are basically acting like genetic detectives, looking back through historical records. They look at the art critic John Ruskin's visual disturbances and cognitive issues, and they align perfectly with CADASIL. And of course, we talked about Nietzsche. If his decline was from CADASIL and not syphilis, that completely reframes his late-life philosophy. It's not just some bold intellectual journey anymore, it's potentially the product of a mind under biological siege. Then there's the composer Felix Mendelssohn. He died of a stroke at just 37, and so did his sister. That really fits a potential familial pattern, doesn't it? And all of this leads to one final, really provocative thought. As our understanding of genetics gets deeper and deeper, we're not just unlocking the future of medicine, we're also getting the tools to rewrite our entire understanding of the past. It really makes you wonder, doesn't it? How many other secrets, how many other stories from our history are just waiting to be uncovered, hidden deep inside our DNA?